Welcome to HIV 101. My name is Tony Jones. I'm the testing coordinator for the AIDS Services Coalition in Hattiesburg, Mississippi. Let's talk about HIV. HIV stands for the Human Immunodeficiency Virus. This is the virus that causes AIDS. What it does is it attacks the immune system, destroying CD4 cells, or what we call fighter cells, that aid in healing. It prevents the immune system from fighting off infections, which most people would not usually be susceptible to. HIV is transmitted 5 ways: through unprotected vaginal, oral, or anal sex, sharing contaminated needles, blood-to-blood contact, mother-to-child during birth, and breastfeeding. HIV is not transmitted through sharing a bathroom, kissing, sharing dishes, food, or drinks, hugging, or any other activity that does not include the exchange of body fluids. HIV is not present in sufficient quantity in saliva, urine, fecal matter, or sweat to be transmitted to another person. So a lot of times we hear that HIV and AIDS are the same thing, or people refer to them as two completely separate diseases. So let's talk about these for a moment. What is the difference? AIDS is a syndrome. It is a progression of HIV. You cannot have AIDS without first being infected with HIV. AIDS is defined by the presence of an opportunistic infection, which is an infection that a healthy person usually wouldn't get, and a CD4 count of less than 200. According to the CDC, once a person is AIDS defined, they will always be AIDS defined, no matter what their labs look like. And always remember, there is no such thing as full-blown AIDS. Either a person is AIDS defined or they're not. So we hear a lot of myths out there today regarding HIV, and today I want to take a few minutes to talk about some of these myths and let's get them straight. One myth is that you cannot get HIV from oral sex. The truth is, though oral sex is the lowest risk, HIV can still be spread that way. Another one, you can get HIV from a toilet seat. Again, HIV is not present in high enough concentrations in urine or fecal matter to be transmitted from one person to another. I hear this one a lot among the youth. If I'm only having oral or anal sex, I'm still a virgin. The truth is, sex is sex. Oral, anal, or vaginal, it doesn't matter. It's still a risk for acquiring HIV and other sexually transmitted infections. And as we've heard from the beginning of the epidemic, people say HIV is a gay man's disease. The truth is, HIV does not discriminate. Anyone can be infected. You might hear, you can tell if someone has HIV by the way they look. The truth is, most people with HIV have no visible symptoms and look completely healthy. This one you hear all the time. HIV can be cured, just look at Magic Johnson. The truth is, there is no cure for HIV. No matter how bad we wish there was, there's no cure. With proper treatment, it is possible for a person to live a long, healthy life with HIV. That's the reason Magic Johnson is so healthy for so long, because from the beginning he was able to afford the medications for his treatment. So what can you do to protect yourself? As far as sexual prevention, abstinence is the only 100% effective method to prevent the sexual transmission of HIV. The second best method is the use of a latex condom every time you have sex. And of course, if you're allergic to latex, polyurethane or nitrile condoms are the second most effective types of condom. Alternative sex methods such as mutual masturbation and frottage can be used to reduce the risk of transmission as well. Preventing other types of transmission. HIV positive mothers should not breastfeed their children. Prenatal care is imperative for HIV positive women. This can prevent the mother transmitting it to the child during the birthing process. Utilize universal precautions anytime you deal with blood or other body fluids. This is things like gloves, face masks, etc. If using injection drugs, learn to clean needles and do so between each use, and never share your needles. I always like to take a few moments in my presentations to talk about stigma, because it's a big factor in getting treatment for HIV. What is stigma? As defined by the Merriam-Webster Dictionary, it's A mark of disgrace or infamy, a stain or reproach as on one's reputation, or B, a mental or physical mark that is characteristic of a defect or disease. Basically, stigma is a negative response or view to a particular group, such as one's ethnicity, sexuality, political views, or health status. How does stigma affect individuals and or communities? The fear of stigma can cause mental distress. Stigma causes violence. It can cause a person not to seek medical attention for fear of the repercussions. And it can cause hardships in interpersonal relationships. Where might you see stigma? At work, you might see it as a loss of benefits. At home, family members not willing to share dishes or utensils. At school, you might see it in the form of bullying. At church, many people who are HIV positive are viewed as immoral or impure. In public, it can be seen as a refusal of services. Stigma leads to discrimination in many settings. So what can we do about it? Those who are educated about certain conditions are less likely to stigmatize an individual or group based on their disease. So education is key. Tolerance. Everyone is different. Try not to condemn someone just because you don't agree with their views. And advocacy. By not allowing discrimination based on medical conditions or other things, we decrease the stigma that's related to the condition, especially the stigma of those affected by it. So some of the contributing factors in the state of Mississippi to the rising numbers in HIV. Mississippi had the highest poverty rate in the country at 22.6% of residents, compared with the national rate of 15.9%. Discrimination, stigma, and homophobia. In far too many communities, these factors may discourage individuals from seeking testing, prevention, and treatment services. Language barriers and concerns about immigration status present additional prevention challenges. Mississippi ranks 8th in the United States for homelessness, with 2,413 individuals counted as homeless in 2012. This is a major barrier in HIV prevention and treatment because studies show that those who are not in stable housing are 3 to 6 times less likely to receive routine health care than those who are stably housed. Homeless persons living with HIV are 5 times more likely to die than those who are adequately housed. The Mississippi Development Authority stated housing is the greatest unmet need among people living with HIV and AIDS, and they estimated that by 2015 more than 3,500 people living with HIV and AIDS will have unmet housing needs.
30 years since AIDS first hit the gay community, cutting-edge drugs mean HIV no longer has to be a death sentence. But in America's socially conservative South, the disease is exacting a staggering toll on the black community. Even as US President Barack Obama endorses gay marriage, homophobia, stigma and denial in the South are exacerbating a striking health disparity in one of the richest countries on earth. North America correspondent Jane Cowan reports from Jackson, Mississippi. You can reach me by sailboat, and a train swing road to road. Take a slant and slide down slow. high, the makeup resplendent, and the show in full swing. In America's Deep South, it takes courage just for these men to be here in this openly gay club. For some, it's even more complicated.
Initially, it was horrible. It was the very thing that I tried so hard not to acquire, and I acquired it. It took me 3 months to get out of my stupor.
Diagnosed a year ago, HIV was the last thing doctors thought to look for when 22-year-old Charlie Lewis got sick.
They thought it was my liver at one point. They really thought that I could possibly have colon cancer. And then they ran one last test, and it came back that I had HIV antibodies in my system. Kind of devastating.
It's hard to imagine a tougher place to come out or to seek help for HIV. This is the buckle of the Bible Belt, dubbed the most religious place in America.
People have not been compassionate and even said things which are horrific in our opinion, that it's God's judgment on them, they chose evil and thus this is God's punishment for them.
Mississippi is a deeply conservative place. It was the last state to end prohibition, one of the last to end segregation, and only repealed its ban on interracial marriage in the late 80s. Now, beneath the genteel southern veneer, a public health crisis is raging. Attention might be focused on the HIV epidemic in places like Africa, but this is the epicenter of America's struggle with the disease. Here in the South, more people live with HIV and die from AIDS than anywhere else in the country. The South has the highest rates of new infections, and here in Mississippi, the death rate is 60% higher than the national average.
We are sort of a third world country in a way. We have people who are in young age, people who are childbearing. We're losing a generation of people to this illness.
Here, HIV is no longer a gay white man's disease. The face of HIV in the South is African American. Mississippi is the poorest state in the Union, and the poverty's worse in black neighbourhoods. So is the homophobia and the stigma surrounding HIV.
The down low is a real thing. Men have sex with men and have sex with women, so people won't think that they're having sex with men. And that is what is propagating the illness.
The shame forces people into the shadows, too afraid to seek help. Half of those testing positive for HIV aren't receiving proper treatment, a rate comparable to Botswana, Ethiopia and Rwanda.
They don't get tested unless they have pneumonia. Or, unfortunately, they get tested when they're in the ER. And then they're already AIDS defined.
Mississippi and HIV is something that they would rather not discuss. So it sort of kind of becomes the quiet truth or the unspoken truth. It's there, we know it's there, but we'd rather not discuss it, which is also almost like homosexuality. We have gays, but we'd rather not discuss them or, even talk about that topic.
When it comes to prevention, sexual health policy is stuck in the past.
I said there are kids in your school district, in your schools, that may be living with HIV.
Abstinence has been the official curriculum in schools.
We have 9-year-olds that are giving birth. They having hysterectomies at 13 and 14 years old because they have a chlamydia going unnoticed.
In an industrial estate beside a Mississippi highway, Valencia Robinson is running her own underground operation, breaking with her abstinence training to give kids the facts they can't get elsewhere.
You should hear some of the things these kids say nowadays. Like, I can't get an STD if I have oral sex. I can't get an STD if I have anal sex.
How common is it for your friends to be having sex yet?
It's very common, like most, if not all. I'm not gonna say all, because most, and then some people who choose to be absent at my school. But I mean, there's a lot of pregnant girls in my school too. So.
Mississippi is #1 with teen birth. We're #1 with gonorrhea. Come on. It's happening. Kids are having sex. They're engaging. They're doing it. And we need to stop acting like this is not happening. Put our head in the sand.
Schools have just been given the option to teach Abstinence Plus, which means they can at least talk about condoms. Change can't come fast enough for Charlie Lewis.
It's home, so I love Mississippi in retrospect, but I do feel that as most gay men living in Mississippi, we want to leave Mississippi because of the not so comfortable ways or not so comfortable society that sort of kind of rejects homosexuality. I have to live somewhere where I can be me comfortable.
Trying to live and let live. Jane Cowan, Lakeline.
I show this video. It was broadcasted on the Australian Broadcasting Corporation. I show it not only because it's informative, but also to bring to light how bad the epidemic is getting in Mississippi. We're not only getting national attention on the spread of HIV in the South, but also on a global level. HIV is a pandemic that is consistently growing in Mississippi, especially among the African American population. The barriers such as stigma and discrimination that prevent people from getting tested, educated, and treated must end in order to stop the spread of HIV. Stable housing is crucial in improving the health of those living with HIV. If you have any further questions, please feel free to contact me via phone at 601-329-2425 or by email at service@121havenhouse.org. Thank you so much for your time, and we hope to see you soon.